Okay, Bismillah ar-Rahman ar-Rahim. It's our deepest pleasure to start today another session of doctorate Viva Defense under the course Doctorate 913 with the International American University. I would like to welcome my colleague, the sincere colleague, Dr. Nuha Nijm. She will be an examiner today. Hopefully, Dr. Akram will join us later. Myself, I'll be the mentor, and till Dr. Akram comes, I'll be the examiner also. Your time is 15 minutes maximum, Rula. You start with introducing yourself, biography, in say 1 minute, 2 minutes, whatever. And then you give us this presentation. After that, we will start cross-examining you for whatever is needed. And then we will leave you for a bit and come back with our decision on what is the result of your work. So I will pick or launch this nice session today. Bismillah ar-Rahman ar-Rahim. Go ahead, Rola. Bismillah.
Bismillah ar-Rahman ar-Rahim. Thank you, Dr. Zahir. Good morning, everyone. Good morning, my mentor, Professor Zahir, and my esteemed committee member, Dr. Nuha Nijm. My name is Rula Ghanem, and I'm honored today to present my doctoral dissertation. It's with the title, The Impact of Implementing Total Quality Management through HCAC accreditation enhancing health crisis management in governmental hospitals in Jordan. It's a post-implementation analysis. And before I dive into the details of my research, I want to express my heartfelt gratitude to those who actually have been pivotal in my journey. This work could not have been possible without the guidance and encouragement of my mentor, Professor Zahir, and every one of my of the doctors who guide me on all the sessions and all courses all over this journey. Allow me to briefly introduce myself. Before just to provide you with the content of my research journey. So I'm currently holding a master's degree in clinical microbiology and immunology and serology from Jordan University of Science and Technology, Jordan, with excellent grade in 2015. And then before that, I had a bachelor degree in medical and biological laboratory sciences from the University of Jordan. I began my career as a laboratory technologist in one of the big chain clinical labs in Jordan. Then I moved to the Ministry of Health, where I was the head of one of the very important department. It's the microbiology department. Then in 2019, late 19 actually, throughout the beginning of COVID, I was the head of Central Public Health Lab of Jordan. On mid of 2023, I moved to CRDF Global, it's Civilian Research and Development organization it's related to research, where I was currently a regional advisor and senior technical advisor for the lab. So, So the abstract of this study, actually, let's start with brief about the study. It's investigate the impact of implementing total quality management system through Healthcare Accreditation Council, which is a national accreditation body in Jordan, on enhancing health crisis management in governmental hospitals in Jordan. It actually focuses on how TQM and total quality management practices, such as leadership commitment, employee involvement, continuous improvement, and efficient resource allocation, contribute to effective crisis response, especially during emergencies like COVID-19 pandemic. Our research, actually, my research was, the approach was by comparing HCAC accredited and non-accredited hospitals, and it focuses and highlights the significance of improvement in patient safety and communication strategies, and for sure, crisis management effectiveness. The finding offer actionable recommendation for policymakers to integrate TQM framework to enhance the resilience of healthcare system in Jordan, and especially in like the higher leadership positions. So before we start, just like this is like a brief introduction for the terms. Total quality management is considered one of the modern concepts in administrative disciplines. Is like the Japanese experience and in management has played an important role in this field, which has brought about development in many work patterns and the privileging belief in organizations, and it's become viewed as a strategy that falls within strategic planning. And actually the components of the QM, it's covered customer focus, continuous improvement, employee involvement, and also empowerment of the employee, as well as process-centric approach and an integrated system and data-driven decision makings. I think there is some noise in the background. Regarding healthcare accreditation system, it's, as I mentioned, it's an independent, not for-profit organization. It's located in Jordan, and currently it's also expanded to the region. It provides accreditation and quality certification for healthcare facilities, primary healthcare laboratories, breast imaging centers, and also tertiary hospitals, and also secondary healthcare. Here's the problem statement and why we are actually I concerned about this problem, and it's the core of that is that management of health crisis in Jordanian governmental hospitals is challenged for sure by limited resources and inadequate planning, and this is what have been noticed during the pandemic. While the Jordan experience in responding, it was one of the excellent experience, while there's many challenges and limitations at that time. So these challenges actually determine that somehow make the ability to respond effectively during critical situation is limited. And the key issues is there is a critical gap in understanding the impact of total quality management principles and their implementation through HCAC accreditation and on enhancing health crisis management capabilities, specifically in terms of resource coordination, patient care, and service continuity. And this is what have been also noticed and observed, and many actually reports have been also developed regarding what are how these challenges also negatively impact the best response during the pandemic. So, and this research aimed to assess the application of Healthcare Accreditation Council standards in Jordanian governmental hospitals and evaluate their effect, the real effect on healthcare crisis management, providing actionable insights and recommendation to improve crisis response for, hopefully not, but for coming maybe healthy crisis or emerging crisis in the future. These are my research questions for this research. The first one is, what are the levels of implementation of HCAC accreditation standard in governmental hospitals in Jordan? The second question is, what are the levels of health crisis management effectiveness in these accredited hospitals? And the last one, how do HCAC accreditation standards affect health crisis management in governmental hospitals in Jordan? What have been found from reviewing the literature, and what is the gaps found? The first one is the limited research on TQM in crisis context, and actually current studies have been only focus on general benefits of total quality management in healthcare facilities, but there is like a limited and a lack of insight into the real impact on crisis management, especially during emergencies like COVID-19 pandemic, or could be other emergencies. And also the scarcity of empirical evidence in Jordan. There is insufficient research on how HCSC accreditation influences crisis response in Jordanian governmental hospitals, and particularly regarding resource allocation and staff readiness. The third gap is implementation challenges, because what also have been noticed from the literature, there is no existing studies. They are highlighting barriers such as limited resources and leadership engagement, which hinder effective crisis management despite accreditation efforts. And this is actually related to other factors, not only for HCSC or for the hospitals themselves. Also, the lack of comparative analysis. There's very few studies that compare crisis management between accredited and non-accredited hospitals, and this is like leave a gap in understanding the real impact of accreditation on crisis preparedness and response as well. Regarding the theoretical framework, so there is like the Deming system of profound knowledge in TQM. So Deming system of profound knowledge provide a holistic approach to management, focusing on interconnectedness within organization. The view is emphasizes in the understanding organizational process and their interactions, while the variation control reducing the process variation enhances consistency and predictability. Regarding continuous learning, encourage data-driven decision-making and a culture of ongoing improvement, while also the impact in healthcare. Deming approach supports structured crisis management, helping hospital maintain quality and safety during health emergencies. Regarding the Joran's quality trilogy, one of the first one is quality planning, which focuses on setting clear objective for quality improvement. And quality control and improvement. So it ensures continuous monitoring and adaptation. And application in healthcare. Joran's framework aids hospital in preparing for and responding to crisis. And also since Healthcare Accreditation Council is focused in quality control and quality improvement, so this is a good way to measure how the accreditation and total quality management implementation will affect crisis management. And the crisis communication theory, it indicates that the crisis and emergency risk communication, it's developed by Central for Disease Control and Response. It highlights this transparent and empathetic communication in health crisis, and the benefit of that theory actually is support public trust, critical for compliance and effective crisis management in healthcare settings. What is the context of this study? It's focused on, as I mentioned, in governmental hospitals in Jordan, which cover all over the country from the north until the east. And we examined the impact of total quality management through health HCSC standards. The scope of the study, it includes both accredited and non-accredited hospitals to assess the difference between the crisis management between both during COVID-19. The key areas for analysis are implementation of TQM principles, with focus on, for sure, leadership, continuous improvement, and employee improvement, and also the role of CSC accreditation in enhancing hospitals' crisis preparedness and response, and comparison of crisis management performance between accredited and non-accredited hospitals. With the objective is to provide actionable insight for improving health crisis management in Jordanian hospitals. And actually, it's a requirement for the Ministry of Health. How the data have been analyzed, we use I have been used the data analysis and statistical tools, statistical software, data.
Rula, can you go back to your case study and elaborate more? Tell me what exactly you've done for the field study. What exactly you've covered, which hospitals, which health sector. Go back, please. Yes. Okay. Tell me exactly. Give me more. I would say feedback on this. It's not very clear to me what exactly has been done.
Okay, so actually it's covered the tertiary hospitals all over the country, governmental hospitals. They are part of the Ministry of Health. They are referring to the Ministry.
How many hospitals? What did you say? It covered how many hospitals? How many?
33 hospitals.
And you've done a questionnaire for that?
Yes, I've been done a survey.
How many persons, and then on what level, which level of management?
183 persons, 183 response have been received. The levels, they covered the higher leadership managers and also quality officers, biosafety officers and head of sections, and also cover the personnel who are...
How many of those hospitals are accredited or by the council, HCAC? How many? Out of the 33, are all of them accredited or examined by the council? How many?
Actually, 24 of them are accredited, while the other are not accredited for now.
And you compared both?
Yes.
Okay, go ahead. Yalla, continue.
I should go back here. Yeah, so the statistics, just to descriptive statistics that summarize and describe survey responses, including mean, standard deviation, and frequency distributions, and virtual statistics that like t-test and chi-square test to compare TQM effectiveness across the
next.
Okay.
Go next.
Okay. All right. So I just summarize these. I include those like tables where they showed the comparison effect of HCAC accreditation standard on health crisis management and hypothesis testing. As you can see in this table, the accredited hospitals who are accredited, they showed that moderately improved crisis management through implementing HCAC, while 21 of the answers have been shown that there is no improvement, with 35 of the answers showed they significantly improved compared to the ones who are in progress and the others who are...
Next.
Okay, all right. So maybe I can move to the answers for the research question. What do you think, Doctor? So, and this table showed the response of that question. What are the aspects of crisis management that, in your opinion, have improved after HCSC accreditation? As you can see, the highest percentage goes for resource allocation, and before that is staff preparedness. And this is actually shows shows the importance of how the training, continuous training and preparedness for the staff is one of the most important issues that should be focused on for preparing for any potential emergencies or pandemic. And here we just compare has the implementation of accreditation with yes or no, just to see the mean level of perceived improvement in crisis management between accredited and non-accredited. This table also focus on what's the in the question focus on long-term benefits that HCAC accreditation will bring to health crisis management in Jordan, with the percentage the highest percentage also focus on improved staff training and preparedness for handling health crisis. So answering the research questions, this is the first research question: levels of implementation of HCAC accreditation standard in governmental hospitals. The implementation of HCAC accreditation standard in Jordanian governmental hospitals showed generally high levels. There's a widespread familiarity with TQM principles and active leadership involvement. However, there are variation in leadership engagement and consistent application of standards. The study shows that approximately 59.8% of respondents indicated having a structured TQM framework, while 21 reported a lack of such framework.
1 minute. 1 minute, Yarola.
Yes.
You have 1 minute.
Okay.
You have 1 minute.
So, okay, all right. So I will move to the second question. The study found that HCAC accreditation positively impacts health crisis management, and most accredited hospitals have formal crisis management plan and regular crisis management conducted. However, there's a variability in training frequency within the study that the hospital that been included in the study. The third question, the implementation of HCAC enhances health crisis management by fostering better preparedness, while respondents reported that accreditation significantly improves staff preparedness, resource allocation. But despite this improvement, there are still areas to growth, particularly ensuring patient-centered care and increasing frequency of crisis simulation exercise. The new outcome that while HCAC accreditation stands to have enhanced several aspects, particularly in areas such as staff preparedness and resource management, there should be also a key funding for staff preparedness, focus more in those, and also resource communication management. And like inconsistent implementation, despite this improvement, there are about 19.6% of hospitals reported that no significant change in their crisis management capabilities have been noticed after getting accredited. The conclusion is that the positive impact of HCAC accreditation, the study confirmed that implementing TQM through HCAC significantly enhanced the health crisis management in Jordanian hospitals, especially in areas of staff preparedness, resource management, and patient safety. There is also a need for continuous improvement. The very important recommendation is the recommendations for policymaker and higher leadership for sustained effectiveness. Healthcare leaders and policymakers should ensure adequate resource allocation and encourage leadership commitment. The recommendation is strengthening the regular crisis simulations and training programs.
Thank you.
Thank you so much.
Thank you. I will start with cross-examining you, replacing Dr. Akram. Dr. Akram phoned me and he said that there was a misunderstanding in the time difference between Ireland and here. Anyway, you'll be joining later, maybe for the next student. I don't know if he can join us now. Okay. First of all, I would like you to go to the title of your research quickly at the beginning.
So maybe I should move 1 minute.
Back. Yeah, you have an arrow down there from the arrow. Yes.
That's this one.
The impact of implementing total quality management through HACCP. First of all, HCAC, you should write it fully and then the abbreviation later. You cannot put the abbreviation in the title. Maybe you can write it down, and then you in between brackets you put HCAC so that when you use it, everybody knows what's going on. Now, you dealt with the crisis management as a black box in your research. You did not talk about the elements when you talk about the crisis management. So how did you define the crisis, and what are the elements of the crisis management? What was the definition that you used and tested between the people that you did?
So yes, doctor, actually it's focused more on health crisis management. So how is the preparedness? It's focused on the preparedness of the crisis.
Don't explain. Don't
how
just give me ideas. Now crisis management. You are talking about the preparedness. Okay, but this is not crisis management. No, this is not a crisis. You said enhancing health crisis management. What are the components of this crisis? What are the crises that you have identified, and how it was dealt with TQM work within your research?
Again, it's a healthy crisis management, doctor, and it's focused on how the resource allocation and how the staff
Again,
also.
Wait. You don't give me the answer to
Okay,
the TQM. I am asking very specific question, and I will not ask you again. What components? What are the crises that you've dealt with in your research? What I've seen that you've dealt with the crisis as a black box. What do you think of the crisis? How we prepare ourselves for the crisis? What should we do for the TQM measures in a crisis? But you did not open that black box. Did you have any place in your research? Did you have any element, any example of a crisis other than mentioning it generally like COVID-19?
Yes, there's actually in the literature review and in the introduction, I've also included the crisis management. I involved like also other examples.
Literature review is not your research. I'm talking about the core of your research. The core, which when you've gone to the model and you've gone to the analysis, you did not dismantle the crisis management and give examples. Okay, let me ask you another. Okay, we finished with that. Let me ask you directly. You are an expert in the health field. You're working there. So tell me, what are the crises that might face a hospital or the health crisis in a hospital? Give me an example, other than COVID.
So other than COVID, there could be like a potential pandemic, not only COVID. Other could be, and most importantly, the respiratory related one, because you know the transmission of such pathogens move like very, very rapidly. Other crises, that shortage of staff.
What are the crises now? You are based in Jordan, aren't you? What are the crises that faced Jordan in the last 10 years, other than COVID-19?
So it depends actually, doctor, on the level of the crisis. There's like a moderate, we can see like some kind of challenges or some kind of crisis where there have been like a shortage in the staff. Could be, this is one of the like sudden shortage in the staff.
Rula, you talk about the medicine. I'm talking about the illness. You don't say shortage of staff. I'm asking you specifically, directly, what are the crises that face Jordan? And you tell me the staff is not there. This is not a crisis. What are the crises other than the COVID-19? Was the cholera is a crisis? Was the cholera a crisis? Was there a health related to floods? Health crisis related to floods? What are the crises that face Jordan in the last 10 years?
Yeah. Okay. The main crisis actually the high number.
Not TQM.
The high number of immigrants, you know, the high number of refugees, because from different countries, like beside Jordan, the Jordan Ministry of Health also, the country also hosting high number of refugees. This is the main crisis for Jordan, on the last 10 years.
Come on, if those refugees are healthy and have no problem. And I presume they are like this. So why do you say, does it compute in your brain that the number of refugees is high, so it's a healthy crisis? No, I wouldn't accept this. What I'm saying that in records from your experience, from your readings, in the last 10 years, what was the crisis? I heard once that there was a cholera pandemic between them. Was it right or not? So what exactly the crisis? Now, okay, let us move to our third question. You said that you started and then you did not complete. There are levels of crisis. There is a severe crisis, intermediate, and low-level crisis. Give me three examples in Jordan or in the world that would be connected to severe crisis. What are the? Give me one example for. Let us open that black box.
Okay. Yes. So just to mention, Doctor, I can consider the cholera that have been suspected cases in Jordan. It's like a low-level one because there's preparedness. But at that time, there's like the rumors that there is cholera outbreak, which is not true because I was majorly involved in that. But focusing on answering your question regarding a very serious crisis happened to the country, maybe worldwide. It's all of us know other than the COVID-19. It could be like any earthquakes, any natural disasters. That could be a very serious disaster. And in some countries like Turkey and also Libya and some of the countries around us in our region they have been experienced such crisis. They have been experienced according
to your research, when would you consider the cholera to be or COVID to be a crisis? When would you say that this is a crisis? Because some of the things that you've mentioned, some of the examples that you mentioned, it might be considered as a crisis in Jordan, but it is not a crisis in the UK because they are dealing with it smoothly and they can manage it. So it is not a crisis. What I want to reach, Rula, and this is one of the things that you've done, you have to do, open the black box in your research. Show us what are the crises and what are the responses. Because of the time limit, my crucial question is when you've done the analysis, you said HCAC, the people who followed this council, they have improved their work. You did not do a baseline for your study. The baseline means before applying the HCAC and after applying, before joining and after joining. The first part of your research, when I asked you and you said 184 respondents from different 33 hospitals, you said 24 were for the accredited ones. By the way, accredited is not the proper way. What is the word in Arabic to start with before going to my question? What is the name?
حاصل على الاعتمادية معتمد. HCAC accredited حاصل على الاعتمادية. هذا is the common word in Jordan.
It shouldn't be accredited and it should be اعتمادية. It shouldn't be both ways. This could be licensed, approved, approval, but not accreditation. Accreditation is something that is related to different dimensions. Anyway, what my question is, you did not, in your research, you did not stick to that line of research. Be careful. I want you to understand this. Your first part of your research is to compare those who are not accredited with those who are accredited under a specific criteria under the 5 questions of your research. And by the way, you have discrepancies between the questions of your research, which are 3, and the output of the research dealing with the questions which are in table 11, 5 questions. So you should match the 3 questions with the 5 outputs. Either you increase that or you decrease that. So you have to be careful. You have research questions and you have answers. You have 3 questions and you've answered 5. So you have to be careful. But anyway, let me go back to my previous comment. You have to have the line of research very clear. If you have a baseline study for one hospital, which was accredited, say in 2015, So you compare the previous history before and after, and you put your parameters, the readiness, the resources, and you apply your research questions. But you mixed it up. You started with comparing those who are not accredited with those who are accredited, and then you went to the same accredited one and you applied, or you compared the previous history with the current history, while you don't have the previous history. And this is very crucial when it comes to research. So you need to look out your research again and make it homogeneous research. Make it with the Simpsons. If either you clarify it very clearly, and as I said, open the black box. And I will end with this remark. Open the black box of crisis and incorporate the research questions element in it, the TQM in each crisis. What we need for pandemic is completely different from what we need for cholera, from what we need for severe crisis is different from low level crisis. So this is very important. Open the black box. Secondly, you go to the concept of comparing those who are accredited with those who are not accredited. And thirdly, give me a section in your place about the regulations, the rules laid down by the Health Crisis Management Council, so that we know what exactly they want and how it was applied. So I need to see in your analysis a page. These are the criteria of the HCAC, and these are the actual situation of each hospital according to these regulations. Before and after. Before and after, you don't have before. So stick to the comparison between non-accredited and accredited, and don't mix it up in any place in your research. And then you put me a list of regulations and how it was within the accredited ones and within the non-accredited, even they did not apply. But what is the situation? HCIC is NGO, but if I was the manager of a hospital with big experience in the quality, I might supersede and be better off without HCCS, because I know about the quality and the response and so on. I finished my recommendation, and it have to, shining. Dr. Akram, Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Did I do the mistake or you changed your mind, please?
No, it's better not to say, for me to say, because I respect you, my colleague. So it's let us, between us, I'll tell you what happened. I told you it's 8, so it's 9 with the Cairo timing, and it's 10 in Jordan. So you pick the time you want. Anyway, no problem. Welcome aboard. I have a feeling that you don't want to cross-examine Rola. I don't know why. So you delayed the entrance here.
No. I am sorry.
Good morning, Dr. Akram.
Good morning, everybody.
It's nice to have you with us again.
Yes, thank you very much. Thanks, Prof. Zahar, for this nice approach this morning. Otherwise, something else will take place. I'm very sorry.
Okay.
I'm very sorry, and I'll be with you, inshallah, now. Thank you.
Inshallah. Jazakallah khair.
Thank you, Dr. Akram. Good morning.
Good morning.
Dr. Noha,
Good morning.
Good morning.
Just
your 10 minutes start now. I've taken your role as a main examiner, Dr. Akram, and I leave you could cross-examine role as much as you want, but let us start with Dr. Noha in 10 minutes, maximum 10 minutes, preferably 5.
Okay.
And then we'll go to, because we have a big number of students today. Go ahead, Dr. Noha.
Yeah.
Welcome aboard.
Yeah, I'm not going to take long, inshallah. Well, as Professor Zahir mentioned, I've expected according to your title, a post-implementation analysis, I expected a comparison between pre and post-implementation, but I didn't find that. I expected to have some data on pre-crisis and the determination of a certain crisis and post it, but I didn't find that. So you would either remove that from the title or apply it to your research. Well, I have a question for you, Rola. It appears that you've studied HCAC methodology in accrediting or licensing the different hospitals, or giving them some accreditation, as you've mentioned or you've called it, on health crisis management. How do they do that? What's the method that they use to assess the quality of management, health crisis management in the hospitals?
So basically, Healthcare Accreditation Council, they have like specific standards because basically, let me say that they are also accredited and certified from a higher organization, international one. It's called ESQA. So they do have specific standards with like specific also references based on WHO and CDC standards for different healthcare facilities. So there's specific standards for the hospitals, others for the lab, others for the...
How do they know if the hospital applies or those standards apply to the hospital or not, the hospital management?
So there is...
How do they know? What's the methodology? Yes, what's the mechanism that they use?
They use the survey, so that they are surveyors who are like also certified surveyors. Those surveyors, they use like specific tool, and they go to those hospitals and apply the standards, and then see how if they are met or not met, and then the overall, like result and the overall score. Define which is the hospital that will also pass accreditation, or its need also to work on like internally to improve to meet the standard, and then they get certified in case they will need it.
How is your study different from their mechanism, what they do?
So because I didn't actually apply the standards for the study, they go with the standards with like these are like a very big tool. They use it with also focusing on all quality parameters, and also they also include part of the crisis management and emergency management within those standards. But actually, the standard for the Healthcare Accreditation Council, they are more detailed, and they are focusing on the detailed technical process within the hospitals. So this is the tool. There's a part of the tool asking for the accreditation standards, but it's not the same as the accreditation standards. It's different. There's one of the questions, like also one they cover the standards that been included in the HCSC like survey methodology, but they are not the same.
Yeah, that's my question. What's the difference between your methodology, your survey, and HCAC survey? Is there actually a need for your survey?
Because it's measure the real implementation. So for accreditation, they go to the hospital, and they see like evidence for application through document review, through observations. But this one, the study, like this measure exactly, is there an impact or not? So this is focused more in the impact and in the outcome, in the real application.
So you think that there is, I don't know, a shortage in the methodology the HCAC used to assess the actual implementation of the health crisis management, or what? How would they benefit from your study? Let's put it that way.
Yeah, so they can benefit from that, focusing more on leadership and governance. There is a part with the accreditation methodology and survey standards on focusing on leadership and governance and communications as well. But this, from my study, it's like it shows that there's a need to focus more in those two important parts, as well as training. and staff, continuous training for the staff, which is also one of the standards. But again, it shows that for the governmental hospitals where there's a very high retirement and a very high, turnover of the staff, it also showed there's like a need to focus more in continuous training for the staff, as well as more focusing, giving more crisis management standards with specifically for the leadership and governance.
Great. My last question. What's the doctor-patient ratio for Jordan? In order to mention the staff shortage, or how you put it, you've mentioned something about the number of staff, but do you think that there is a shortage in Jordan with regards to patient doctor ratio, patient nurses, staff versus patients?
Yeah, and actually this has been identified from different assessment reports that been done through many WHO, many other non-governmental organizations and partners who are focusing on supporting the country on healthcare part. So the reports of those assessments, and also there's many studies that also focus on the understaffing and the high turnover of the staff, other than the observation for everyone. So it's not only the doctors.
Rola, with regards to the training, do you have any recommendations for the training, or just general training? Because I'm sure that HCAC requires some level of training for the staff.
Yes.
What improvement, what recommendations do you have for this specific type of a training to be implemented in order to improve the hospital's performance?
Yeah.
Did you actually study the requirements, the training requirements?
Yeah, the training should be focused more on crisis management, simulation exercise, making some drills, there's some simulation exercise have been done within the past couple of years, but again, there's a need for more simulations and more frequent exercises, given the current situation and how we experienced the last COVID-19 pandemic response. So in my opinion, there could be also focus more, not only in technical training, also, and there should be more focus on crisis management and doing drills, simulation exercise, and those where all stakeholders should be also involved, not only the health department or the health workers, hospitals, and also other main stakeholders in the country.
Great, thank you. Rola, what I would like to ask you to do is to show more on, to focus on the importance of your study, how is it different from HCAC accreditation standards, and how would HCAC actually benefit from your study? Okay, thank you, Professor Zahir.
Thank you.
I'm done here.
Thank you. Dr. Akram, do you want to participate, or shall we leave it to the next one? It's up to you.
It's up to you. No problem. You can decide, Prof.
Open the mic, Dr. Akram. Dr. Akram, open the mic, please.
It's open. It's open, mic. Do you listen to me, everybody?
Yes, we can hear you, Doctor.
Yes, Doctor, we could hear you. Professor Zahar, we can't see you anymore.
I lost connection. I don't know. Anyway, I'm now back. Again, Dr. Akram, do you want to cross-examine or shall we move?
Up to you, Prof. Up to you. You can decide.
Okay, we will. I think we will move to I would say deliberation on the output, and then we will come back with a new student after giving Rola our decision. Okay, thank you very much. We will see you in a bit. Thank you. Salam.
Thank you.
Yes. Thank you, Rola.
Thank you, Doctor. Thank you. شكرا. إن شاء الله
عفواً.
خير.
إن شاء الله كل خير. Okay.
دكتور أكرم تدخل معنا، ادخل الكاميرا لو سمحت.
Yes.
Okay, welcome again. يعني after our deliberation of your work, Rula, we know that you are a sincere and devoted doctorate student. After a thorough discussion, we've decided to give you a pass with minor corrections. So congratulations for getting that title and welcome aboard as a doctor, Rula Ghanem. You deserve it, but you need to follow up with me so that we fix what needs to be fixed in your research and have it to the level that we want to have as a doctorate student. Congratulations, and may Allah give you guidance and give you the ability to serve your country, your people, and so on. Dr. Noha?
Congratulations, Rula. Can you hear me?
Yeah.
Your title is very important. I would highly encourage you to work more with Professor Zahir on the implementation of your study to fit with the title, because it would give very important recommendations for HCAC, and I'm sure they would appreciate it. You're doing a great job. Congratulations.
Okay, Dr. Akram.
Thank you, Prof. Zahir, and again, sorry for being late today. And I would like to say congratulations for Rula for getting the title, and in the same time, I'm sure that she will work hard with Prof. Zahir to make her work more fashionable and more acceptable, and to the extent which will make it equivalent to a PhD work. Thank you very much.
Okay.
I have myself some actually notes. I put my notes on the dissertation, and I think I can pass it later on to Prof. Zahir and Prof. Zahir. Yes, I put everything on paper. Thank you very much.
That's very good. Thank you very much. Okay, congratulations.
Thank you.
Any last word from you, Rula? Go ahead.
Thank you so much, Professor Zahir, Dr. Naha, and Dr. Akram. Thank you for your time, your support, and your great discussion with me. You are also empowering me during this, not only throughout the doctorate journey, and also during the discussion and the dissertation defense. Thank you again, and all the best for all my colleagues. Inshallah. Thank you so much.
Thank you. Congratulations. Mubarak. Now, Ibrahim
Can I
English,
ask
I'm giving you the
question,
floor.
Doctor? Can I ask a
question,
Doctor? Can I? Is there any? Can I have an idea about the grades or now?
What do you mean? You passed. What do you mean by the grade?
Oh, okay. So there's no different grades within after the dissertation defense. So thank you so much.
Just pass or not pass. Sometimes we give distinction, but it's not the case. Okay. Now we will